Hello friends, welcome to Info Station 360. Today our topic is Guillain-Barré syndrome. Guillain-Barré syndrome is a rare neurological disorder in which a person's immune system attacks the peripheral nerves, and it's also known as acute inflammatory demyelinating polyneuropathy. The demyelinating form of Guillain-Barré syndrome destroys the protective covering of the peripheral nerves myelin sheath, preventing the nerve from transmitting signals to the brain. Next is types. There are four types. First, acute inflammatory demyelinating polyradiculoneuropathy. It's a common sign is muscle weakness that starts in the lower part of your body and spread upward. That is toes to nose. Second one is Miller-Fisher syndrome, in which paralysis started in eyes and it also associated with unsteady gait. Third one is acute motor axonal neuropathy. Fourth, acute motor sensory axonal neuropathy. These are the types. Next is etiology. First is gastrointestinal infection. It's caused by Campylobacter jejuni. It's a common cause of gastroenteritis. It mainly caused by food poisoning transmitted by ingesting poorly cooked meat or poultry, unpasteurized milk and contaminated water. Second is respiratory infection. It commonly caused by cytomegalovirus, Epstein-Barr virus and Mycoplasma pneumoniae. Third, after surgeries, flu vaccination, blood transfusion, and transplantation. Pathophysiology. The pathophysiology of GBS is complex. It is considered to be an autoimmune disease triggered by a preceding bacterial or viral infection. There is Campylobacter jejuni, cytomegalovirus, Epstein-Barr virus, and Mycoplasma pneumoniae are commonly identified antecedent pathogens. The following picture is about the nerve damage after GBS effect. The above one is the normal nerve and the below one is the myelin sheath is been showing how it is damaged after the effect of GBS and its exposed fiber is seen. The body's immune system begins to attack the body itself. The immune response causes a cross reaction with the neural tissue. When myelin is destroyed, destruction is accompanied by the inflammation. These acute inflammatory lesions are present within several days of onset of symptoms. Nerve condition is slowed and may be blocked completely. Even though the squamous cells that produce myelin in the peripheral nervous system are destroyed, the axons are left intact in all but the most severe cases. After 2 to 3 weeks of demyelination, the squamous cells begins to proliferate, inflammation subsides, and remyelination begins. Next is signs and symptoms. The common symptoms are weakness of legs and arm affect both sides equally, weakness of muscles of face, swallowing difficulties, and weakness of eye muscles are seen. Hyporeflexia result to quadriplegia, neuromuscular respiratory failure, cranial nerve defect with facial palsy, ptosis, diplopia, facial weakness, dysarthria, dysphagia are seen. On neurological examination, reduced strength of muscles or absent tendon reflex are seen. In Miller-Fisher variant of Guillain-Barré syndrome, a triad of weakness of eye muscles, abnormalities in coordination, absent reflex are seen. Respiratory failure due to weakness of breathing muscles. Weakness may increase until muscle cannot be used at all and may result in paralysis. Inability to work due to muscle weakness and paralysis. Difficulty to speak, chewing and swallowing various muscles required to form speech are weakened. The GBS common symptom in short: limb weakness, difficulty swallowing, shortness of breath, flaccid paralysis are being seen. The next one is diagnosis. GBS is diagnosed by spinal tap lumbar puncture, second nerve conduction studies, third CSF analysis. In this, elevated protein content is up to 700 mg per deciliter. The normal value of CSF analysis is 15 to 45 mg per dl. Then fourth, electromyography, first MRI, 6 chest X-ray, stool culture to rule out the presence of cytomegalovirus or mycoplasma. Differential diagnosis. First, acute peripheral neuropathy in that porphyria, systemic vasculitis, poliomyelitis, diphtheria, tick paralysis, critical illness polyneuropathy. The second major is disorder of neuromuscular transmission, botulism, myasthenia gravis. Next is central nervous system, basal order occlusion, acute cervical transfer myelitis. They are the differential diagnosis. Next is management. Ventilatory support will be given for the patient. Plasmapheresis, that is plasma exchange, are being given. Intravenous immunoglobulins. Rehabilitation is being done. Next is complication. After the GBS syndrome, patients having lingering weakness, numbness, other or sensation even after recovery. Heart or blood pressure problems, pain, slow bowel or bladder function, blood clots, and bed sores due to paralysis.